Providence Medical has been serving Northwest families for more than 100 years with exceptional, compassionate care. In fact, the presence of Providence in Everett dates back to 1905. But the story of Providence begins nearly a century earlier with one woman's vision and vow to simply care for and serve others. Emily Tavernier was born in Montreal in 1800 and at the age of 23 married John Baptiste Gamelin. Her happiness was short-lived, however. Within 5 years, her husband and all 3 of her children died. In her grief, Emily Gamelin plunged into the work of the Ladies of Charity in Montreal, an association for the relief of the city's poor. She came to see all the poor as her new family. Eventually, Emily partnered with the Bishop of Montreal to establish the Daughters of Charity, Servants of the Poor, later known as the Sisters of Providence. On March 29, 1844, after pronouncing her religious vows, Emily Gamelin was appointed the first Mother Superior of the congregation. The Sisters of Providence grew rapidly and achieved much under Mother Gamelin's direction until her death in 1851. From her deathbed, she urged her sisters to be ever mindful of the virtues that she herself had embraced throughout her life: humility, simplicity, and charity. Above all, charity. While Mother Gamelin founded the Sisters of Providence, it was another amazing woman who brought the Sisters of Providence to the Northwest. Mother Joseph of the Sacred Heart was born Esther Pariseau in 1823 on a farm in southeastern Quebec. Raised the third of 12 children, Esther learned many practical skills, including sewing, weaving, and caring for children. In addition, her father was an expert coachmaker and taught his daughter carpentry and design. Esther chose to pursue a life of service, joining the Sisters of Providence still under the direction of Mother Gamelin. As a novice, she was trained in nursing, working in the Sisters' pharmacy and infirmary. She used her sewing skills to make robes and vestments, and assisted the treasurer with financial matters. In 1845, Esther Pariseau took her vows of poverty, chastity, obedience, and service to the poor, and received her new name in religion, Sister Joseph. In 1856, Sister Joseph led a group of 4 brave and hardy Sisters of Providence on a trek across the continent, from Montreal to what was then known as Washington Territory. The Bishop of Montreal dedicated the mission and bestowed a new name on its young superior. Sister Joseph would henceforth be known as Mother Joseph of the Sacred Heart. It would be impossible to overstate the importance of this woman in the establishment of Providence in this region. Under her leadership and trusting in divine direction, more than 30 hospitals, schools, and homes for orphans, the elderly, and the sick were opened in Washington, Oregon, Idaho, Montana, and southern British Columbia. Mother Joseph of the Sacred Heart died on January 19, 1902, at the age of 79. Her last words to those gathered around her bed were, "Allow me to recommend to you the care of the poor in our houses, as well as those without. Whatever concerns the poor is always our affair." Just 3 years later, in 1905, the Sisters of Providence purchased Everett's Monte Cristo Hotel for $50,000 and turned it into Providence Hospital. Staffed by 11 sisters and 3 employees, the 75-bed hospital treated more than 400 patients that first year. Across town, a smaller hospital was already up and running. Founded by the Women's Book Club of Everett, the city's General Hospital was established in 1894, just 1 year after the city of Everett itself was incorporated. Both hospitals grew and moved into progressively larger facilities, with frequent discussions of an eventual merger along the way. In 1994, exactly 100 years after the founding of Everett's first hospital, Providence and General Hospitals became a new entity under the sponsorship of the Sisters of Providence Health Systems. Today, Providence Regional Medical Center Everett is spread over the Pacific and Colby campuses and several other facilities throughout the region. Guided by the philosophy of the Sisters of Providence, we faithfully honor their vision of caring for the poor and vulnerable in the communities we serve. We never turn away a patient who cannot pay, and every day, throughout contributions of time, expertise, and money, we reach out to help those who need us the most.